Hi, I'm Dr. Cook with EP Dentistry for Kids, and I just wanted to talk a little bit about conscious sedation. So conscious sedation is one of the services we offer for our patients that are highly anxious or sometimes very hyperactive. Maybe they won't sit in a dental chair for more than a few minutes. Sometimes they've had a previous traumatic experience somewhere else, and they kind of need to build that trust back up with the dental community, with our staff, which might be new to them. Sometimes special needs kids, it works well for them. But it's a step above our laughing gas, our nitrous oxide. So that's more for mild anxiety. Conscious sedation is for our more highly anxious kids. So how it works is it's important for your kid to not eat for about 6 hours before their appointment. So they have to come in, nothing to eat or drink. And it's also important that they not be sick. So no cough, no congestion, no fever or anything like that. If that's the case, then we'll have to reschedule for another day, which could delay treatment, for several weeks sometimes. But they come in the day of the appointment. It's typically in the morning. They take a little medication, and it's based off their weight and their height and that type of thing. The medication, depending on which kind, takes about 30 minutes to an hour to work. So you'll sit in the waiting room, a nice, comfortable, usually dark room with the TV, to let the medication kind of take effect. After it starts working, we bring them into the treatment room. We also use the laughing gas and oxygen to kind of relax them a little bit more. We also monitor their vitals, so their heart rate, oxygen, blood pressure, all of those things are monitored the entire time to ensure that they have a safe procedure, a safe working environment. Depending on the treatment, sometimes it's one visit, sometimes it can take more. Just depending on how well the sedatives work. And it's also important to note that conscious sedation is not general anesthesia, so they're not put all the way to sleep. There's no IV, there's no tube, there's no general anesthesia medication. So their protective reflexes are still intact. Sometimes they fall asleep, that's fine. Sometimes they're just awake and cooperative, that's fine also. After the procedure, the child is typically numb, so you really want to watch them afterwards, the first few hours. Make sure that they don't bite themselves, their lip, cheek, or tongue. So really, really liquid diet, very soft foods progressively throughout the day. We ask that no dairy be given, because sometimes that can make the kid nauseous, and also any foods that may have given them problems in the past, we like to avoid those after the procedures. And then very important to not have any activity, so no school, no daycare. If they're working, no work. No sports, no recitals, that type of thing for the day. After the next day, they're typically fine to go back to resuming normal activities. If you have any questions, you guys can always reach out to our office, and we'll be sure to answer all your questions. Thank you.